Hi, my name's Shauna. I graduated from Wayne Community College in 2011, and I've worked primarily in the acute psychiatric setting with adolescents since. However, I worked on a med-surg unit for a year to gain medical experience and to enhance my nursing skills. It didn't take long for me to realize that psych is where my heart is at, and I love my job. My short-term goal is to continue working on my bachelor's, and my long-term goal is to apply to a master's program and ultimately become a nurse educator. At some point along the way, I do intend to get more medical experience so that when I become a nurse educator, I am proficient and can teach from experience. When I first began working on my unit, there was a charge nurse who made it a point to make my life hard. She gave me some of the hardest assignments and was of very little use when I'd ask for help. I felt as if she wanted me to fail. Many nurses, herself included, were getting a lot of overtime due to staff shortages, and she felt like if I was successful, her overtime would be in jeopardy. She made it very difficult to transition from school into real-world nursing, and I felt intimidated by her. Since we only have 2 to 3 nurses working at a time, she was the only person I could turn to for help, and she would often steer me wrong. When I began to work as a charge nurse myself and train new nurses, I made sure I was approachable, and if I didn't know an answer, I would work with the new nurse to figure it out. This experience made me more aware of how I come off to new employees and inspired me to be a better leader. When I started working on the med-surg unit, my experience was very different. There was a charge nurse who was particularly helpful. She would always offer help and had a knack for recognizing when someone was beginning to feel overwhelmed, even if they didn't recognize it themselves. I noticed that the dynamics of the whole unit were affected by her positive attitude and willingness to help. With a good charge nurse, everyone was relaxed and more friendly, and the quality of patient care was improved. Her example motivated me to be a positive, helpful leader and to never allow someone to struggle if I can help them.